So University Hospitals is located in Ohio. It spans 15 counties. It consists of 18 hospitals and over 40 ambulatory locations. So we decided to deploy a VNA in order to create that single repository of the images, that single knowledge database of where those images reside, and to bring all the images together into a single location. So cost savings that a facility can recognize include the cost to migrate. So currently, if you were to swap out your front end, let's say your PACS system, you would have to migrate all those images from one system into the new system. If you have those images already residing in Enterprise Image Management or VNA, then you wouldn't have to do that migration because that VNA knows where those images reside. You could just disconnect your front end application, plug in the new front end application, and you would have those available. The other cost savings is image lifecycle management. Today, from what we've experienced, we've not been able to necessarily purge the electronic records because there wasn't an easy way to do it. So with the VNA, that's one of the functionality that's included is the ability to purge the records based on a site's retention policy. Another cost savings would be the maintenance of the hardware. Previously, you could have 3, 4, 5 different hardware archives, different for each location. Now it's centralized, so you're not having to manage 5 different setups. You have a single server storage solution on the back end. Although it can support multiple, but as you replace that hardware, you can grow that and see that cost advantage. Some of the things I think are important based on lessons learned of deploying a VNA or even considering implementing a VNA are engaging the other vendors early along with your VNA vendor because they are key in being involved in the migration, and understanding that there can be challenges, but really the vendors can come together and get through those challenges. The other thing is getting the input from the users. It's behind the scenes for a user, but it does impact them. It does. I think the greatest advantage looking back is the single point of accessing those images, whether it be from an EMR, an AEMR, a physician portal. We've image enabled all of our different systems. And then the other advantage when you're looking at a VNA is making sure that they can display that single patient record regardless of what the medical record number is. So if they come from facility A and their medical record number is different than facility B, you want to be able to see that patient record on the user interface. You want to be able to click on that patient and you want to see the full record. It should be seamless to the physician. A hospital should expect from a vendor in the implementation of a VNA the potential workflow changes, the possibilities of integrations, a work plan, a basic work plan to say these are the steps that we consider, but then you would customize it for your facility. Health systems should really consider Sectra because they have an intimate relationship with their customers. They listen to the customers, and you see the end results. And they include you in the development, they include you in the discussions of what their future roadmap is, and they get your feedback and they do listen.